Dissolution testing is a very big topic, a vast topic to understand and study. I have made many videos, but still, I think we should learn and we should study the dissolution in much detail. Because dissolution is not only the quality control test, but it is also performance test for the oral formulations. It is the test based on which we can get the biowaivers, based on which we can demonstrate the safety and efficacy of the formulation, and based on which the regulatory authority gives the approval. So if you consider dissolution as a test only, it is not sufficient. It is directly linked to the clinical effect of the drug pharmacodynamics, and it supports the biowear application, and there are many applications based on the dissolution results. Considering the critical material attributes, critical process parameters, we should understand the dissolution in relation to these terminologies. Whenever you are working onto the formulation, always think that what will be the parameters, those will affect the dissolution and the drug release. So from the day one, you will have the good understanding. CMAs, CPPs and CPAs to dissolution. This is the topic. Critical material attributes. These are the attributes of the material which directly impact the dissolution and the drug release. For example, consider the assay and particle size of the drug substance. Assay is not much critical because you are going to compensate the assay, but particle size will play a great role in dissolution. So CMAs like particle size, API polymorphism, and formulation excipients like binder, disintegrants, lubricants, their type and the concentration directly affect the dissolution. Consider this video for the oral formulations, and you can consider the examples like tablets and capsules and oral suspensions, so that you can relate these things. Then granule hardness and porosity, tablet hardness, tablet thickness, porosity will affect the dissolution. These factors directly affect the dissolution by influencing the disintegration time, disintegration pattern, wettability and the porosity. So critical material attributes are related not only to the raw materials but also to the formulations. Then critical process parameters. The processes like wet granulation, including the kneading speed, total granulation time, lead uptake, drying temperature and time. Then granule size, milling speed and the screen size, blending speed and time, lubrication speed and time, compression force for tablets, coating parameters. Then the parameters related to the capsule filling like slug hardness, particle size distribution of the blend. These all are the CMAs and CPPs. Mainly the machine speed you can consider, compression force you can consider, milling speed and screen which will affect the PSD, granulation time, lead uptake and the drying temperature and the time. These parameters will determine the tablet density, tablet porosity, then hardness or resistance to crushing, or in other words you can say mechanical strength of the tablets, and these all will impact the dissolution. Then critical product attributes. So this might be the new term for you. These are the simple terms like critical material attributes, critical process parameters. So this one is the critical product attributes. So what is the percentage drug release at different time points? Percent variability, dissolution profile similarity, F2 similarity, sensitivity to the pH, volume and agitation speed. These are the measurable outcomes that connect the formulation and process choices to the clinical performance. So critical product attributes are the dissolution requirement points. Dissolution media also affect the dissolution. So if you are using the media which is not showing sink condition, it will be difficult to demonstrate the dissolution. Discriminatory media helps to detect small differences in the formulation on process. Biorelevant media correlates better with the in vivo absorption and predicts the bioavailability. Not only the CPAs, CMAs and CPPs, we should also understand the biorelevancy of the dissolution media. This is the preliminary information for the factors which are affecting the dissolution. Thank you for watching the video, and I am happy to see many of the people are watching and they are providing their comments and raising the queries. I will try to answer your queries and I will try to give you the answers. Once again, thank you for watching.